Hey everyone, and welcome to our latest phlebotomy study log. This video focuses on the chapter on safety, and I have 24 questions prepared for us. For each one, hit that pause button and see if you can figure it out before I go over the answer. I hope this helps. Let's get started. Number 1. Name the organization that regulates workplace safety and define its purpose. The Occupational Safety and Health Administration, OSHA, regulates all work environments to prevent accidents. It provides guidelines for accident prevention. Number 2. Name 6 types of safety hazards in the workplace and give an example of each. Biological, such as bacteria and viruses. Sharps, such as needles, lancets, and broken glass. Electrical, such as dangerous high-voltage equipment. Chemicals, such as preservatives and reagents. Laboratory-grade chemicals. Latex sensitivity, such as an allergic reaction to latex in gloves or other equipment. Physical, such as wet floors, lifting heavy objects, and patient transfers. Fire or explosive chemicals, such as oxygen, open flames, or other flammable materials. Radioactive, X-ray, such as equipment and reagents. Number 3. List 6 safety precautions that can reduce the risk of injury in the workplace. 1. Practice hand hygiene. 2. Always wear the appropriate personal protective equipment, PPE. 3. Avoid touching your face, including rubbing your eyes, nose, or mouth in the work area. 4. Never store food or beverages in the laboratory refrigerator with reagents or specimens. 5. Do not let anything hang loose that might get contaminated or caught in equipment. 6. Protect your feet from spills, slips, and falling objects. Never wear open-toe or open-back shoes. Number 4. Because needle sticks are a major concern, what should you never do after performing a venipuncture? Never recap after collection. Needle sticks can occur. Number 5. Describe the purpose of an SDS. A safety data sheet provides information on the chemical, its hazards, the procedure for its cleanup, and first aid in case of exposure. Number 6. Chemicals should be labeled properly. Number 7. Explain the purpose of a chemical hygiene plan. A chemical hygiene plan describes all safety procedures, special precautions, and emergency procedures used when working with chemicals. Number 8. When mixing acids and water, you should add acid to water. Number 9. In the event a chemical spills on your arm, what steps should be taken? If a chemical spills on your arm, proceed to the safety shower, flush the area for 15 minutes, and go to the emergency room for treatment. Number 10. Safety equipment in the laboratory may include 1. Personal protective equipment. 2. An emergency shower. 3. An eye wash station. Number 11. List the 6 identifying features that all hazardous material labels must display. OSHA mandates the use of the Globally Harmonized System, GHS, of classification and labeling of chemicals. The GHS label contains information on the identity of the chemical, the chemical manufacturer or other responsible party. Appropriate hazard warnings are communicated through the visual symbols called pictograms. Explanations of the hazards involved in exposure to the chemical. A list of precautions to reduce risk. First aid measures to take in case of exposure. Number 12. The yellow diamond in the NFPA, National Fire Protection Association, label indicates reactivity warning. Number 13. The blue diamond in the NFPA, National Fire Protection Association, label indicates health hazards. Number 14. The red diamond in the NFPA, National Fire Protection Association, label indicates fire hazard flammability. Number 15. The white diamond in the NFPA, National Fire Protection Association, label indicates White is for special hazards, such as those that are water-reactive or oxidizers. Number 16. Describe the steps in the emergency response to electric shock. In the event of an electric shock to someone, turn off the equipment or break contact between the equipment and the victim using a non-conductive material. Do not touch the victim until the risk of further shock is removed. Call 911, start CPR if indicated, and keep the victim warm. Number 17. The first action to take in the event of fire is to remove patients from danger. Number 18. List the 5 classes of fire and at least one fuel responsible for each class. Class A fires are fueled by wood, paper, and cloth. Class B fires are fueled by grease, oil, and flammable liquids. Class C fires are fueled by energized electrical equipment. Class D fires are fueled by flammable metals. Class K fires are fueled by cooking oils and cooking grease. Number 19. The first thing to do when giving CPR to a victim is determine whether the victim is conscious. Number 20. Describe the protocol for hands-only CPR, cardiopulmonary resuscitation. The protocol for assistive breathing is as follows. Determine consciousness. If there is no response, call 911 and begin rescue breathing. Make sure the victim is flat on a firm surface. Check the airway. Position the victim's head. If the victim is not breathing, pinch the nose shut. Place your mouth over the victim's mouth and exhale. Check to see whether the victim's chest rises, indicating a clear airway. Give 2 full ventilations and check for breathing, and continue until breathing occurs or until assistance arrives. Number 21. Explain the process that should be followed in controlling a bleeding emergency. To control a bleeding emergency, you must apply pressure to the area or wound, elevate the limb unless it is fractured, and maintain pressure until medical help arrives. Number 22. List the signs of shock and the steps to take to prevent further complications. The early signs of shock include pale, cold, clammy skin, tachycardia, rapid pulse, shallow breathing, weakness, and nausea, vomiting, or both. In case of shock, keep the victim warm and lying down with the airway open and call for professional assistance. Number 23. What is the best way for a phlebotomist to prepare for a disaster that occurs in the community? The plan to follow during a disaster emergency varies from institution to institution. It is important to learn and know your institution's disaster plan. Number 24. Describe 3 types of reaction associated with latex usage. A. Irritant contact dermatitis, redness, swelling, itching. B. Allergic contact dermatitis. The body's immune system reacts to proteins absorbed through the skin. C. Anaphylaxis, rapid severe immune reaction. Airway may swell shut, heart rate increases, and blood pressure decreases.
Thank you for watching. Don't forget to subscribe to our channel for more content.